Hello and welcome. Thank you so much for joining me today. My name is Alicia Saavedra, and I'm a certified child life specialist. Today, I'm going to talk a little bit about how I use my child development knowledge as a child life specialist and hopefully answer some questions that you might have about the career. A little about me. Like I mentioned, I'm a certified child life specialist and have been since November of 2000. Most of my career has been here at Loma Linda University Health. In 1998, I actually started as a child life assistant in our hematology oncology playroom, where kids can come and play and be distracted from some of the things that are happening in the hospital. It's a way for them to express and to learn and to socialize when they're not in their normal environment, being at home or in school. My primary experience has been on the hematology oncology unit. I moved into the child life specialist position there and worked in total just under 9 years in that area before going into our acute care or general pediatrics area, where we see lots of different diagnoses and procedures and traumas and different things like that that come in our hospital. And eventually moved into our surgery area and also worked per diem, which is like a substitute. We work all over the hospital where child life specialists need staffing. So if someone has a day off or calls in sick, or we're short-staffed somewhere, our per diem staff come in to help fill those gaps. Currently, I am in academia, so I work full-time as a professor here at Loma Linda University in the Master's of Science Child Life Specialist program. And my role is as the director of clinical training. So I oversee the practicum and internship placements of our students and help support them as they're going through those clinical training experiences as they work towards certification. And I also work with our Association of Child Life Professionals. I am the immediate past president on the board of directors and have been involved with lots of their committees and chairing different positions and contributing as a subject matter expert. My contact information is here as well. If you have any follow-up questions or need more information about becoming a child life specialist or wanting to know a little bit more about what a child life specialist does, please feel free to reach out. So if anything, at the end of this presentation, I hope that you can remember that child life specialists, our main primary goal is to help children cope. Children experience a lot of different stress and trauma from coming into the hospital or having other stressful life experiences. And child life specialists are expert in helping and helping them and their families cope with those different stressors that they're experiencing. I'm going to share with you this video in just a moment, but I'd like to share a little bit about some of the services that we do provide. Child life specialists really focus on providing preparation for patients and their families so that they can understand what to expect when they're coming into the hospital or having a surgery or a procedure, or even what's going on with their body if they have a new diagnosis. We provide a lot of education around those things so that they can understand in words that are familiar to them. We provide distraction from some of the pain or discomfort they might be feeling through different activities. We also provide play. Play is used for many different reasons, and I'll share a little bit more about that in detail later. And we also show them how to cope with the things that they're experiencing. So teaching them techniques and providing them with some coping tools so that they can get through some of the experiences that they're having in the hospital or outside of the hospital. And there's many other benefits that child life specialists can provide for these children and their families. And I'll share just a little bit here in this video. All right. So if you could pause and reflect just briefly, what about the hospital or other crisis situations do you think would be stressful for a child or an adolescent? If they came into the hospital, what kind of things would they see or smell or hear? Think about from that sensory experience, the five senses. If you think about those, what might be stressful for a child at different ages and stages? That's where we really use a lot of our child development and our assessment skills. And then when thinking about that, what even comes up for you? Maybe you might have had a previous experience with healthcare or a stressful crisis situation. What are the emotions or things that are coming up for you, and what might have helped you during those stressful events? And what do you think adults in these stressful events can do to help children understand what's happening? Earlier, I just talked about using words and language that they can understand. That means that we change a lot of the medical jargon that we hear and we break it down into words that are understandable for children at their age and stage. And what are you even maybe more curious about, or what feels a little confusing or unclear about how you could help children during these types of times or experiences? And how do you think children might feel when they hear big words about healthcare or their bodies that are not at their developmental level? So we want to make sure that, again, that we're giving them information that they can understand in a way that they can understand. And that takes a lot of our child development theory, and we're applying it to real life situations. So here you'll see a list of child life services that we provide to lots of different children and families when they're coming in for a short stay or a long stay, if they're coming in for an accident, routine care, any of those types of things. We use a lot of play in our job. And so play we use as an assessment tool. We can see the child's developmental level as we're engaging with them in play. We use it to establish rapport and have a therapeutic relationship with them. We also use it in education. So we use a lot of different play techniques as we're providing education and preparing them for what to expect, or maybe even sharing about their diagnosis. We also provide bedside activities for fun, to pass time, to promote their normative development, and also for emotional expression. So we do lots of different interventions for that as well. We also have different ways that we can support not only the patients, but their families. So working with brothers and sisters, with their parents and extended family, their caregivers, the adults in their lives. We also want to create social connections and help them to be able to find healing in community. So finding other kids or families that may be experiencing something similar. And we have playrooms. Like I mentioned, I was a child life assistant. So we have playrooms that they can come to. Sometimes being in the hospital can be scary, and sometimes kids don't know how to express their feelings. And so they are responding to us with their behaviors. So we have to think about different management techniques that we can use to help them adhere to their plan of care, whether it's taking pills or, getting a poke for certain medications and things like that. And we also want to be able to provide them with support if their child is at end of life, or if they're experiencing their grandparent or a parent dying. And so we also provide support in those situations as well. One of the things that we are really big on here at Loma Linda is community outreach. And so we do something called teddy bear clinics, where we go to some local schools and we teach the children there about what it's like to come through the hospital, and they bring their stuffed animals, and we do like a little mini pretend hospital or clinic, and they bring their stuffies through, and they get weighed and they get measured and they get the pokes for the flu shot. They also get to use some of the real medical equipment and do play. That healthcare play really helps them, one, to work through sometimes feelings or fears that they might have in a safe way when it's not being done to them, but they're able to be more in control of that interaction. It helps us to educate them. So we're using that as an educational opportunity. And it also helps us to assess and understand their understanding. Sometimes they'll come and tell us things that are not exactly the way that it happens in the hospital. And so we're able to, correct that misinformation and say, well, actually, when you come to the hospital, this is what's going to happen. And we're also able to teach them coping skills. So we might say, oh, you can hold your teddy bear's hand while they're getting a poke. That teaches them that they can do the same thing when they go for a poke or get a poke, and they can ask their caregiver, can you please hold my hand? Or can we count? Or can we take deep breaths so that we can relax and get through that poke? And so play is such a powerful tool that we use. And to the naked eye, people think that we're just having fun, but we're really using these interactions and these play techniques and tools in a very, very intentional way. We also are a resource for staff, and so we are always working with our teams to ensure that we're supporting children's development, but also to help advocate for children. Sometimes nurses and doctors and other healthcare staff don't always know child development knowledge, and so it's helpful for us to be able to say, that child is crying because this is actually a really normal and response to feeling scared because of, and maybe we'll talk about a diagnosis or a procedure or things like that. And we can help them understand why they're stressed and why they're responding to those particular stressors, because that's normal for their age and stage within their life. And then we can also figure out how can we collaborate together so that we can advocate and support that patient and their family as they're going through these experiences. And like I mentioned before, my role is to oversee practicum and internship experiences for our students. And so as a child life specialist working in the hospital, I used to also supervise directly and train future child life specialists. And so that is another thing that we do in the hospital where we're overseeing volunteers, but also future child life professionals. So you might have heard me use the word tool before, the tools of a child life specialist. Um, Big thing that we do is we apply developmental theory to all the things that we do. We are assessing children and their temperament, their personalities, the different things that might be stressing them at their particular age and stage, depending on their psychosocial and cognitive development. We're looking at family variables, stressors, social determinants of health, and also healthcare variables. So are they going to be having a procedure? Is there something that's painful that's happening? Is there a new medication routine that they have to be on? What are those different things that are impacting that particular child and family? And what is that, how does that determine their intervention level in the sense of the higher the stressors, the amount of stressors, the more likely that a child life specialist is going to spend more time with them or provide added intervention versus someone who's on a lower level of stressors. Then they can meet a child life specialist and work with them, but they can also, work with a child life assistant or having a volunteer at bedside to play versus having intense therapeutic interventions to help manage active stress and crisis in relation to, let's say, a big, huge surgery or a major diagnosis, things like that. So that helps us to inform who we're going to see, when we're going to see, and what we're going to provide. We provide tailored interventions. So the toys that we choose, the materials that we use, the activities that we select, or how we adapt them because of a child's ability, all of those things, again, we're using our developmental knowledge. Some of the theorists that we use, and you might hear them or recognize their names, Erik Erikson, Jean Piaget, Axline and her play approach. There's lots of different theorists that we use from child development, and we meld those together and we create our approaches and how we decide, again, what is going to be the most beneficial for that particular child based on the developmental and psychosocial assessments that we have done. And we always want to meet a child where they're at and their families. And so when children come to the hospital, yes, they may be at a certain developmental level, but because of stress, they may regress and have different behaviors that they may not have been regularly showing at home. So we want to make sure that we're meeting them where they're at their current development, and then go from there as far as supporting them and coping with what's going on and navigating through that stressor. We establish rapport and we build therapeutic relationships. And a lot of times, again, like I mentioned before, we're using play to do that. Oh, we're playing a game with a couple of friends here in the playroom. Do you want to join us? Oh, look at these stickers. I have some extra. Would you like one? And that might sound really innocent, but that's a way of just creating emotional safety and psychological safety for that child to feel safe to engage with us, to express their thoughts, their feelings. And that helps us, again, assess what is going on, what's in that child's mind, what's their understanding of what's happening. And then that helps us to be able to be responsive to those needs that we can see and hear from them. We adapt our language to fit the developmental and educational needs of the patient and their family as well. And so when we're doing that, we're thinking, what are big words that a child would be scared of or be stressed about? Is this ambiguous? Is it clear? And so we use something we call soft language. And so we adapt the words that we hear in the hospital and we make it into a way that children can understand. So, for example, if we say, oh, you're going to take a ride on a stretcher down to surgery, if we hear stretcher, what does that mean? I'm going to stretch, you're going to stretch my body. Or I can say, oh, you're going to take a ride on a bed with wheels and it's going to go down to the surgery area where you're going to have your surgery. That makes a lot more sense. It's concrete and it's easier for a child to understand. And then the other thing, like I mentioned before, play. We cannot talk about play enough. We use techniques that are therapeutic, expressive. We do medical play and healthcare play, like I mentioned with our teddy bear clinics. We allow children to actually use medical equipment, real equipment, to be able to explore and learn. And normative play. Play is just play. It's fun. It's what kids do. And so we also want to provide them just that opportunity to do that as well. Some of our kids that come to the hospital really enjoy painting or Play-Doh or board games, different things that they like to do, journaling. And so let's, be able to meet them again where they're at, understand their interests, and provide them with something that feels good for them so that they can grow and thrive despite some of the stressors that they're undergoing at that moment. So talking about play, play is the child's symbolic language of self-expression. And for children to play out their experiences and feelings is the most dynamic and self-healing process in which children can engage. And that quote is by Eric Erikson, and that really sums up a lot of what child life specialists do. We help them play out their feelings, play out their experiences. That helps us understand how they are understanding what is happening in their environment, what's happening to their bodies, and how we can help them heal from some of that stress or trauma that they are being impacted by because of what's going on with them. So again, I have a little short video. It's going to talk about, it's actually going to have child life specialists talk about and share with you directly what their jobs are.
Child life specialist helps patients and families to cope with being in the hospital. We help to reduce the trauma that happens here during medical experiences. Overall, we just help to make it easier on families and patients while they're here in the hospital.
Here at CHOP, we're one of the largest child life programs in the country with just over 75. You can pretty much find a child life specialist anywhere that you would go, especially at our main campus, from the emergency department to every inpatient unit. I personally cover outpatient clinics in the Burger Center, and we even have some that are covering our satellite locations.
The type of schooling that you need to become a child life specialist is a minimum of an undergraduate degree with a child life internship. Some of us have master's degrees as well.
As child life specialists, we help to support both patients and their families for hospital procedures. And we do this by helping a child to understand what's happening to them and around them in a way that they should understand. So if I'm meeting with a 3-year-old, I'm going to talk with language that a 3-year-old should understand. A 10-year-old, a little bit higher level. We also help to develop coping plans. So we figure out how can we make this as easy as possible for you at the hospital and walk away with a smile.
So working in the NICU, procedural support looks a little bit different. I actually work with the infants during even the simplest procedure, like changing a diaper. I may be providing some facilitated tucking, like tucking their arms and legs into their body to help to support them, to help keep them calm during those things. For children here at the hospital, they may come into the hospital not having any sort of medical experience previous to this visit. So if they know what's going to be happening, it makes that visit easier for them.
Research studies show that anticipatory stress is far better than unexpected stress. And so we know if we provide kids the developmentally appropriate education before an experience, not only are they going to be far more compliant with their medical care, but they're also going to have a much greater level of trust among their caregivers while they're here, and that is absolutely critical for children.
As child life specialists, we really look at our role as people who help the entire family cope, so not just the patient, and that many times includes brothers and sisters as well.
We're going to help to normalize the hospital experience for them, so that may be taking them down to the studio to play bingo, doing a project project with just them and not the patient, because that gives them that special one-on-one time that they need.
When we think about helping to prepare kids transitioning to home or to school, we approach it in very similar ways as we might prepping them for procedures and for the hospital experience.
Their family and friends may be asking questions about why they're in the hospital. So we help to prepare them to answer those questions. So we may do some role play with them to get them thinking about questions that people in the community may ask them.
We really try to not just focus on what happens here at the hospital, but how are they going to transition into life and still be normal kids with these new treatment or medicine that they have to take after they leave the hospital. A lot of times the medical team will say that they feel like Child Life comes in with their magical wand and is able to wave it, and then the child is able to cope well with the procedure. And it's not that we have a magical wand, but we really just use simple, honest information to explain to the child what to expect in a way they should understand, and then help to give them tools to make the experience easier for them.
There truly is a theoretical foundation for everything that we do.
You may see us playing, you may see us laughing and being silly, but we are a vital part of your child's care team by helping them to cope with being here at the hospital, by teaching them why they're here and preparing them for anything that they're going to be going through, while we also are supporting you as the family.
So you can see there's a wide range of things that child life specialists do. But I want you to pause just for a moment and think about, when you watch that video, what clues did you see or things did you heard the child life specialist saying, and how they're using their child development knowledge. And as you can see too, we work with a wide range of ages. We are working with, you saw that child life specialist, the tiny little itty bitty baby, and that baby is in the NICU setting, meaning they are just days old or weeks old, all the way up into 18 and just beyond into young adult years, up to about 25 even for some specialties, because some specialties actually don't have doctors who take care of adult patients. And so our pediatric doctors are still following them when they're seeing for that specialty care, meaning, whether it's hematology, oncology, gastroenterology, which has to do with your stomach system and digestive system, sometimes cardiac care for your heart, different things like that. Those are called specialties. And so some hospitals or areas don't have specialties that go into adult age. And so they're still being cared for under pediatrics, even when they're 21 or 22 sometimes. And so for us, we have to have a wide range of developmental knowledge across the lifespan so that we can work with children, again, teenagers, young adults, but even young infants who are newly developing. And so we can figure out, how do we support that development as they're getting older, but also how do we work with children's family members? We're working with the adults that are in their families, and just because they're adults doesn't mean that they are coping and having all the tools at their fingertips as well. And so we're looking at what are some of the things that might be distressing a parent or distressing someone at a certain age or stage of their life. And so really looking at development in a holistic view. Where can I find a child life specialist? Child life specialists work in all kinds of different units. I've talked about a few of them as I'm talking about being a child life specialist, but here's a list of some. You go to different hospitals and you'll see them called slightly different names, but for the most part, these are what we call our inpatient. So that's when children are at the hospital, staying the night for their care. And then we have outpatient areas. So things that are what we call ambulatory or outpatient, meaning in the clinic settings. So something that they come in for, they get seen, and then they get to go home at the end of the day and they're not sleeping there. Those are also our emergency or departments or trauma departments, and even our behavioral medical centers, these outpatient cares. They have outpatient programs that children can come into for their mental health support, but they're not staying overnight. But we do have a behavioral medical center that is connected to our hospital, where they also have inpatient programs where kids are actually a resident of that hospital until they're well enough to be discharged home. And I mentioned community-based as well. We have child life specialists that are working in community settings. Some are doing what we call private practice. Some are working in schools. disaster relief whenever there is some type of big disaster event, whether natural or man-made. And also we have some that are even working in our local counties as social workers working to support kids who are transitioning through foster care. So there's a lots of different areas that child life specialists have used their skills. So a little bit more about that variety of setting. I'm not going to show these videos, but these are links to different videos of child life specialists and their work in these specialty areas. So we work with infants, children, adolescents, young adults, and the families that are in their lives to minimize that stress that's coming from their particular illness or injury. But these specialty areas like Burn Center, or a child advocacy center, which is working with kids who have potentially been abused or hurt, whether sexually or physically. Child life specialists will work with those kids coming in for an exam. They have to have a physical exam and also an intake interview, and that can be really stressful and that can be really scary. And so a child life specialist can help explain what's going on to their body, why they're there, assure them that it's not their fault, and that they're coming to the hospital or to the clinic to be assessed, but it's just that we want to make sure that nothing has happened to their bodies that has hurt them. And if it has, then we want to make sure that we can help them get better. And so there's lots of different places that child life specialists work. And here's about 6 different videos that you can watch to hear a little bit about child life specialists in their particular area. My healthcare fairy godmother, I'll just point that one out, is actually a patient, and she talks about her encounter with a child life specialist in the hospital and how they worked with her. There are different two different qualification pathways that you can pursue to become a child life specialist. Both of them entail completing coursework in 10 specific content areas. You have to do a 600-hour clinical internship under the supervision of a child life specialist who is certified. And then you sit for your exam, and then you do exam maintenance. Now that's the short version of becoming certified. I'm actually going to play this video really quickly to share a little bit about some of those qualifications. All right. So, like I mentioned, when I first started my introduction, I have worked with the Association of Child Life Professionals. And so that's our professional organization. Under the umbrella of the ACLP, we have something called our Child Life Certification Commission, and so CLCC. The Certification Commission is the entity that determines what qualifications a certified child life specialist needs. And so when you go to childlife.org, you'll see a lot of information about those different requirements. And in the near future, there'll be a microsite that will be launching under CLCC. So CLCC will have their own little mini website that will have more information that's expanded and continues to, again, share the different requirements and maintenance for certification. And again, there's the website there if you have more information that you're looking for. Like I mentioned, there's 2 different academic pathways. So there's one clinical pathway, meaning you have to do a child life internship, but there's 2 academic pathways. So the first option is to graduate from an ACLP endorsed child life academic program. You can locate the list of ACLP endorsed programs on their website. The second option is to complete those 10 college courses in addition to having a bachelor's degree. So the minimum requirement to become a child life specialist is a bachelor's degree. Many do also have a master's degree. It just depends on your educational pathway and experience that you have in becoming a child life specialist. Some people find out about becoming a child life specialist once they're at the end of their bachelor's degree, and they go on to have extended college courses that are non-degree seeking, and they make sure that they have those 10 college courses, or sometimes they opt to enroll in a master's program. And so the list of courses is here on this particular slide. You can see them. And again, you can find expanded information. If you click on that little link on the lower right-hand side, you'll see a much more detailed explanation. And in addition to, like I mentioned, the coursework, you're going to have your clinical preparation. So while it's not required to do a practicum or become a child life volunteer to become certified, it usually is strongly preferred by a lot of programs who are interviewing and reviewing applicants that are coming through for their internship programs. And so it's an introductory experience to have at least a practicum or some type of volunteer experience, so that you can understand what a child life specialist does, work with a child life specialist or a team or with children in the hospital, so that you're acclimated to that in particular environment. It is different from a child development center or daycare or nannying. It is very much, very different environment to adjust to. And some people do volunteer, and they confirm that they really do want to go into this particular field of work. And others will volunteer or do a practicum and realize, you know what, I think it was a great experience, but I'm not sure that I would like to work in that particular environment. And they decide to either pursue seeing how they could use those child life skills in a community-based setting, or pursue a different type of career path. And so again, just making sure that, whatever path that you go down, always encourage you to explore and look for different ways to have that exposure, so that you can verify that this is something that you want to do. And so, again, it's not required, but it is usually strongly recommended or preferred to at least have a practicum or extensive child life volunteer hours within a child life program. And aspiring professionals will eventually complete a 600-hour clinical internship. It is a competitive application process. I do want to be very transparent about that. And so being able to have an academic advisor, someone that can help you with that process, is usually something that will be beneficial for you as you're looking up some of these requirements. And there's different ways that you can have that advisement, whether you're enrolled in a program, and there's other advisors out there that sometimes will also be able to provide that support. And once you've completed that, then it is time to sit for the certification exam. And so that exam, once you pass that exam and become certified, then you're what we call maintenance mode. So you're going to still complete professional training units, professional development hours, or sometimes they're referred to as the CEUs, continuing education units. And you'll have to do at least 50 of those every 5 years. I believe it's 50. So again, I just want to say thank you so much for joining me today. I hope that you have learned something new about children being in the hospital, whether or not you pursue a child life career. Child life specialists are there. We're here for you. We're here for your families. We're here for people that you know in your own social circle and communities. So anytime you know of a child and family that's going to be in the hospital, please ask for a child life specialist, because we're here to help you, so that it doesn't feel so scary, and that it's less stressful. Here's some additional, again, resources. I have childlife.org, which is the Association of Child Life Professionals. You'll see our certification commission information there as well under that website. Loma Linda University, our Masters of Science Child Life Specialist program, where I teach. If you have questions about what it might look like to go and get a child life degree, there's information on that website, so you can kind of see the types of coursework that you would be completing. And there's also the Children's Hospital Child Life Department, so you can see the child life services that are being provided at the hospital. While we are under the same umbrella of LUH, Loma Linda University Health, we are two completely different departments and we work in different areas. So I am on the university side and the department is in the hospital side. So we do collaborate quite often, but we have different leadership and administration. So anytime you have a question about volunteering or that particular department, please contact them and ask them about those different things. I can, again, refer you to them in the sense of I can give you the website and where to find that information, but we have two different, like I said, entity. So I wouldn't have too much more information other than general volunteer type of requirements and website that I could connect you to. And again, if you have questions and want to know more, please feel free to reach out. And I will be sharing the slide deck with your professors so that they can also share it with you in case you want to reference it for later. Good luck with all your future aspirations, and I wish you well.